late last night. All right, Robin, good morning.
Hi.
And you're from?
Dallas, Texas.
And we're going to ask your legal permission. We're going to talk to you, and we might bring up some personal issues.
Uh-oh. Everybody knows it anyway.
Should we keep that?
No.
Do we have your permission to use this?
Absolutely.
Okay.
Yeah.
Good. You've been through all this. You're the last person you videotaped this morning. Any questions that remain unanswered?
I really think that we've done a really good job of covering everything, plus things that I hadn't thought of.
Yeah, I thought we had some good questions this morning. The protein question, I forgot.
It's helped to alleviate my nervousness a whole lot this morning. So.
And we did have some people who had some pain yesterday.
Yeah, you
but
did.
they got through it pretty well. I mean, you could have a few minutes of that.
And I've heard the availability of drugs is right there. So.
Yep, you're going to have a team of nurses
exactly.
right there. So, yeah.
My arm be out like this. Gosh, yeah. Really. How does wink?
We'll get into one of those orange whistles, the emergency
yeah.
whistles.
Oh my God.
Oh, that's Robin.
But no, I feel a lot better. I'm excited. Not so, I'm excited about the health benefits that I know I'm going to have and the swelling that will finally go away. But I'm just as equally excited about the social benefits that I'm going to regain. And that's really, really important to me.
Yeah, well, we see that so much, and it's very exciting. And of course, we know that if we were good people, that we would judge people by their character.
Exactly.
But how people look affects our decisions about them, and it happens all the time. And I see it all the time in my experience. And the one story I like to tell is I had a patient of mine named Raymond James. And he was a Baptist minister and an undertaker.
So wow.
I think that's okay, on the weekends. I don't think there's a conflict of interest there. But very nice guy, very hardworking, wonderful guy. But when he first came to see me, he had kind of a round face. He was heavy and just seemed jolly, seemed like a friendly guy. And so I envision, when I'm talking to people, I think about them a little bit, what they do and things like that. And so I thought of him preaching to me. I thought it'd be a very jolly sermon. He came back a year later. He brought his wife to have surgery with me. His wife's first name was Snow, so I operated on Snow James, but actually her maiden name was White. So. Really? Yeah, I operated on Snow White. But after she married, and he wasn't that tall. No, he wasn't a door. But anyways, when he came back, he had lost all this weight, and so all of a sudden he had this square jaw, this commanding presence, and I know him from before, and I got to know him, and I know how I felt about him. But as I saw the different person, I just felt totally different. I felt his sermons would be very scary.
Yeah,
when he was like this, it was like, oh, okay. And so you see this in people all the time when they look different. I mean, I think we judge people differently. And certainly people who are heavy often get labeled, as they tell me, as not as smart, not as caring about themselves. We hear lots of people whose jobs get limited.
Exactly.
That you're not going to get another promotion. You can't go and tell IBM how to run their business as a consultant when you can't take care of your own weight.
Absolutely.
So
yeah.
we hear that so much, and it's not right. We understand that. But on the other hand, we certainly hear about it a lot. So we hope we'll affect that in a positive way for you.
Yeah, I think you will. Can I do one more thing?
Sure.
Say hi to my friends at band camp.
Absolutely.
Hi,
yeah.
girls. Hey, that's all. Band camp rules. That's another story, too.
All right, good.